Okay, good morning. Good morning, Dr. Muhammad Farhan.
Morning.
Okay, good morning. Okay, ladies and gentlemen, we are about to start the seminar in a minute. Okay. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. We would like to say thank you for attending this seminar in this bright and lovely day. I'm your host, Betari Bunga, would like to welcome all the participants in today's seminar with the title, One Health Principles in Handling the COVID-19 Pandemic in Malaysia. First of all, I would like to say our gratitude to God for the blessing so that we can gather here today in this seminar. We would like to welcome the Honorable Professor Dr. Sularto, the Dean of Postgraduate Program in Diponegoro University, and Professor Hadianto, the Vice Dean of Postgraduate Program in Diponegoro University, and Dr. Dwi Suteningsih, the Head Program of Master of Epidemiology in Diponegoro University, Professor Suharyo Hadisaputro, the lecturer in Master of Epidemiology Program in Diponegoro University, and our keynote speaker, Associate Professor Dr. Mohammad Farhan bin Rusli, and our moderator, Dr. Budi Laksono, and our beloved committee and participants. Before we start this seminar, let's pray that the event will run well and all the materials will be beneficial for us. Pray, begin. Pray, finish. As your host, I would like to remind you that all microphones should be muted except while singing our national anthem or asking questions in the discussion. So now, ladies and gentlemen, please turn on your camera and unmute your phone because we will be singing our national anthem, Indonesia Raya. Okay, now to open today's event, we would like to invite Professor Hadianto, the Vice Dean of Diponegoro University Postgraduate Program. So for Professor Hadianto to deliver opening speech, the floor is yours.
Thank you very much, Betari, for introducing me. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, ladies and gentlemen. Honorary Speaker, Dr. Farhan Rusli from International Islamic University, Malaysia. the head of Master Program of Epidemiology, all senior lecturer, professor, and lecturer and staff of the programs, and all participants. Assalamualaikum warahmatullahi wabarakatuh, and thank you very much for your attendance today on the series of the event of visiting lecture conducted by Master Program of Epidemiology School of Postgraduate Studies at Diponegoro University. Today, I'm very much honored to have Dr. Mohammad Farhan Rusli from International Islam University, Malaysia, who will deliver his presentation about One Health Principle in handling COVID-19 in Malaysia. Of course, this topic is very interesting and fit to the current situation as we still have pandemic COVID-19. Although, or according to the data, we have much better condition right now with low cases per day. The successfulness of the handling of COVID-19 in Indonesia and also other countries not only responsible for the governments, but also all the actors in this country, including all the epidemiologists, experts, and also others health workers. And today we will also learn how Malaysia overcome the pandemic COVID-19 from their approach. But the most important is that the pandemic COVID-19 only can be treated not by one actor, of course, but it must be done for a multi-sectoral approach and transdisciplinary approach and collaborative approach. And indeed, this is a definition for One Health approach. And our schools, School of Postgraduate Studies, continuously supporting these events and also all the initiative combating COVID-19 pandemics. And I would like also thanks all the committee, all the organizing committee, of course, and then master program in this case of epidemiology. And finally, personally, I would like to welcome Dr. Rusli to our school, and thank you very much for your kind talk and sharing your knowledge in overcoming the COVID-19 pandemic. And we would like to hear your lecture. And by saying Bismillahirrahmanirrahim, I officially open this visiting lecture. And thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Hadianto, for the speech. So we would like to proceed to our group photo. So ladies and gentlemen, please turn on your camera. Okay, ladies and gentlemen, please turn on your camera. We will start taking the pictures now.
Yeah, camera Pak.
Yeah.
Yes. 1, 2.
Mana disuruh buka mic kamera ni? Mana ni cepatnya? Buka kamera. Aduh lanjut ah.
1 minute.
Dia buka kamera ini foto.
1 minute.
Loh, nak lupa.
Okay.
1, 2, 3. Okay.
Okay, for page 1, for page 2.
Kamera buka kan? Kak Nurayati ya.
For page 3.
Kak Nudro ada tu dia.
Okay, for page 4.
Enggak, tenang pula.
For page 5. Okay, for page 6.
Mana orangnya? Nah, Kak Nur orang tu Ridho yang tu.
Okay, okay, we are finished with the group photo. We would like to remind you once again to turn off the microphone and only turn on the microphone while asking questions in the discussions. We also would like to remind you to fill the registration attendance list, which is located in the chat box. So it's in the Google form. So please make sure that you already filled the registrations, because the certificates will be sent directly to the email. Okay, now we arrive at our most awaited core event. We'll be talking about COVID-19, a topic that we all have been really passionate about. So ladies and gentlemen, please welcome our keynote speaker, Associate Professor Dr. Muhammad Farhan bin Rusli, Chairman of the Malaysian COVID-19 Task Force and Malaysia One Health University Network, from Department of Community Health, IIUM, Malaysia, and also our moderator, Dr. Budi Laksono. Ladies and gentlemen, please welcome our keynote speaker and our moderator. Okay, good morning, Good morning, Professor Muhammad Farhan bin Rusli.
Assalamualaikum. Can all of you hear me well?
Yes.
Yeah, okay.
Bismillahirrahmanirrahim. Some small ice-breaking first. First, I want to say thank you to everyone for inviting me for the session. I think it's a great honor for us to share our ideas. Selamat pagi semua. Just a brief history. My grandmother was born actually in Jogja, and she moved over to Malaysia with my grandfather. I still have my village and my kampung in Jogja, Medan, and in Bandung. I go back every year, but since the pandemic, I can't go back. But yeah, I think we are more interrelated than what we seem to think. And I think what the pandemic has shown us is that a lot of things happen, and it affects it affects everybody around the world. So no matter where you are, because the world has been globalized in such a manner, we feel that whatever actions done in one single country may have detrimental effects in other countries as well. So there's a big debate on what COVID-19 actually is. There's a lot of pandemic fatigue. So I was thinking, how is actually the best way for me to actually give out the information, not to make it too boring, because I also sit in lectures. I know how 1 hour lecture sounds like. Sometimes we tend to sleep and we tend to snooze. So I hope that it can be as interactive as possible, and I hope that we can share ideas and we can be very open about this. I have some slides to share, so I'll be sharing that. Can everybody see the screen?
Yes.
Yes, all right. So you talk about One Health approach and COVID-19, specifically in Malaysia, but the first thing that is actually very important to note in the topic itself is the One Health approach. So as you know, a lot of times we have always tried to distinguish or try to separate between animal health and human health. And what we fail to understand is that everything that we do to the animals has an effect on the humans. Everything that we do on the humans has an effect on the animals. And we see that a lot of zoonotic diseases cross barriers. And when they cross into species or they cross species, we have outbreaks and we have pandemics, and it leads to where we are now. So the key approach into tackling this is not only from the human approach, but it must also be from the animal approach as well. As you know, the most important thing about an outbreak is about stopping the outbreak. It's about not letting it spread, not letting it move around, not letting it spread. And if you cannot stop the outbreak from its origins, how can you expect to solve the pandemic? So that's why it's really interesting, where we need to have a disaster and chaos for us to be able to actually start solving things together. And I was thinking on how we could actually do this. So my idea was to actually give you a timeline. So I'll be talking on 6 specific timelines in accordance to Malaysia. I think Indonesia have done fairly well because one of the smartest things that Indonesia have actually done was to take the Sinovac vaccines quite early on. However, there's still lots of discussion and debates about efficacy and all that. We'll get into that much later. But what's important to note is that what the pandemic has taught us is that quick actions, preparation saves human lives. So it's important to note that for Malaysia, it was a little bit different. We had to suffer before we actually learned what to do. We had to go through a lot of difficulty before we can go through easiness. And of course, casualties occurred along the lines, livelihoods were lost. But what was important was that we tried to understand what we could actually do to make our
Professor Muhammad, Farhan, sorry for interrupting. Hello, we would like to welcome our moderator first. Yeah, okay. So, yeah, welcome our moderator, Dr. Budi Laksono. Good morning, Dr. Budi Laksono.
Good morning. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. So here I would like to read the CV of our moderator. Our moderator for today is Dr. Budi Laksono, Master of Health Science. So one of the lecturer in Master of Epidemiology in School of Postgraduate Studies in Diponegoro University. Dr. Budi Laksono finished medical school in Medical Faculty of University of Diponegoro in 1989, and then studied Master Program of Reproductive Health in Queenstown University in 2000, and then finished Community-Based Care and Preventions of HIV and AIDS in Chiang Mai, Thailand in 2002, and finished PhD program in Diponegoro University in 2012. Throughout life, Dr. Budi Laksono finished several research focuses on helminthiasis and also open defecations in Serang and Pekalongan, and also helminthiasis again in Pekalongan, and open defecations with amphibi model in 1995 and 1996. If you're interested to contact Dr. Budi Laksono more, you can contact through email, drbudilaksono@gmail.com, and the phone number. Dr. Budi Laksono joined several organizations, for example, the Rotary Club Pandawa, Semarang, in which Dr. Budi Laksono is the president-elect, and also Semarang Harm Reduction founder, and Semarang Red Cross Committee member, and Wahana Bhakti Sejahtera Foundation founder, and also the secretary of Semarang Health Committee, secretary of Blood Donor Association Central Java, and secretary of Central Java Travel Health, and international WC for All organizations, in which Dr. Budi Laksono is a founder and general secretary, and also a member of COVID consultant of Central Java Province. And throughout his life, Dr. Budi Laksono achieved several honors: Best Field Medical Doctor District of Pekalongan, and Best Medical Doctor or Dr. Teladan for Upper District Pekalongan, and Best Medical Doctor in Central Java Province 1996, and blood donations for the 25th and 5th and then 50th and Aceh Disaster Volunteer in 2004, and also joined Bantul Yogyakarta Disaster Relief in 2005, and Tacloban Disaster Emergency Relief, and also MDGs Award 2012 for HIV and AIDS Services, and Changemaker for Rotary International 2013. So without further ado, we would like to welcome our moderator, Dr. Budi Laksono. The floor is yours.
Yes. Thank you, the committee of the seminar. My name is Budi Laksono, and all you hear my CV that read by the committee. And today, Alhamdulillah, we got good healthy, and now we will join the seminar that invite Mr. Professor Farhan Rusli that will present about the Malaysia effort in handling COVID-19. Ladies and gentlemen, we know that COVID-19 is a pandemic that affecting all over the world, and Indonesia and Malaysia affect this COVID, and many illness and death appear in both countries. And Malaysia aware about the pandemic and earlier than Indonesia to aware and got the struggle to eliminate. And Indonesia in March about 6 aware and indicate that Indonesia need the good effort to eliminate the COVID-19. However, we learn a lot in the first to Malaysia that the success to eliminate the COVID. Even though now we know that COVID-19 still threaten us in all country, and now Indonesia and Malaysia the number decreased so far, and the death also decreased good. However, we still aware that the lesson from the pandemic, particularly influenza, will affect the human in more than years. So we should discuss and join and contribute to eliminate the COVID in our environment. And today, Mr. Professor Mohammad Farhan will share about the success in Malaysia, and in this time we can learn and then how to copy the success to Indonesia too. Even talk now Indonesia growing success to eliminate the COVID pandemic in Indonesia. I will read. Sorry, Mr. Professor, that I should introduce you CV to our audience. Mr. Professor Mohammad Farhan surprised us, I think, when Indonesia, when every time we hear about the professor, usually they are old, they are have no hair and anything. But when I saw you that you look like a film star compared with the professor, and it is good for us to find your experience in Malaysia. And I read your curriculum vitae. Firstly, the name Mohammad Farhan bin Rusli as a professor in Kuliah of Medicine, maybe in Indonesia like Fakultas Kedokteran, in International Islamic University Malaysia, in Kuantan, Pahang. His academic qualification, he is a medical degree and from Russia Federation 2010, and then got the master public health degree from University Putra Malaysia in 1915, and then Doctor of Public Health in UPM Serdang Selangor in 1980, and he got the administrative experience from firstly he is a medical doctor in the field with the Kementerian Kesehatan Malaysia, and then after 2015 he became a lecturer in University Malaysia, become a lecturer, and then assistant professor since 2018, and now a coordinator of kuliah Each coordinator is like decan or maybe anything, and then assistant professor in 27 May 2020 until now. And he got many courses, and also he had many students that supervised by professor, particularly in the master degree. And he got he report some research. It's very good and inspiring us. He got many research and also publication. His publication is a lot, and it's very interesting about the public health and also the technical of medicine. And thank you for your coming, Mr. Professor Rusli, and please you can start now to present your presentation. Thank you.
Thank you very much for the kind words. I think I jumped the gun just now and I started a bit earlier. So is it all right if I just go on where I left off? Is it okay?
Okay.
All right. Thank you so much. So as you can see, when we move on to the timeline, I mean, you guys can see the screen on the timeline, right? January 2020 and all this. All right. Just want to make sure that you guys are seeing the same thing. Dr. Budi, thank you. So I was really thinking, how is it that I would be able to present Malaysia and what we went through for the past 2 years in an hour? So it's definitely not going to be something which is quite possible. So I give the highlight reels. So you know that if we tell the whole story, everybody falls asleep. But if you tell only the good parts and the bad parts, everybody's interested because you always spend time on the drama itself. So I was also thinking, would it be possible for me to just keep telling the good things about what the country has done, but it wouldn't show exactly how the epidemiological and the public health response actually was? To be honest with you, when the pandemic started, all the countries did not do well because none of the countries knew what was actually happening. Nobody knew how bad was it going to be. We all thought it was going to be like another SARS scare, another thing such as MERS-CoV, where it died down by itself, where we thought it was going to be big, but it did not. This time around, what happened was we actually underestimated the severity of it. And that's why when it's surfaced in Wuhan, late 2019, in Malaysia, we did not do much. We said, you know what, it's okay. You know, we went through the bird flu, went through all these things, not to worry. We're gonna get ourselves out of this in no time. So we didn't do any active interventions at the moment. Although the public health specialists were already sounding the alarm and telling them, look, something needs to be done because something is wrong. So if you don't do this, you are not going to get yourself out of it. So sorry, I just wanted to check. Are you guys looking at me changing the slides or not? Can you see the slides change? Mas?
Yes, you already have a screen. You can continue. Yeah.
I mean, can you guys see the slide changing?
Not yet.
Oh, you guys cannot see the slide
yeah.
changing. So that's why I wanted to double check, because I'm scared that you guys are not seeing what I'm sharing. All right. Can you see the slide changing now?
Yes. Okay.
Oh,
okay. Yes.
All right. So this is the timeline that I was explaining about, from January to March to October to February to June to November. So these are the 6 timestamps that I would like to focus on. These are the 6 things that we would like to speak on. So when I said that we didn't do anything, literally we didn't do anything. So in January 2020, on the 25th of January, we had our first 3 imported cases. So they came in from mainland China. And we said, no problem. We are smart because we detected them early. We got to screen them at that screening point. But what we didn't count on was that when we actually caught these people, there were already more people coming into the country. There was already more people actually going around the country, spreading the virus. But we didn't catch it. We didn't catch it in time. And this was about the alpha and the beta variants. And this was very, very early on the pandemic. And the first Malaysian test positive with the coronavirus on the 4th of February. And at this time, we knew that something was not right. It was as though it was spreading more than what we thought it was going to be. Because why? Because we thought we caught them in the entry, but actually they were spreading it around the country without us detecting it. So in that January 2020 is when none of the responses on public health was actually focused on COVID-19. So the news was not centered on COVID-19 because at this time, we were in a political turmoil. We were very focused on the politics of the day. We were changing governments. We were having meetings. The politicians were doing other things. So the policymakers were shifting their mindset away from what was happening and arriving at the Malaysian shores, and they were actually focused on the political agenda of things. And this political agenda and these political issues will play a very critical part in the way the pandemic actually moved in the country of Malaysia. And it's very unique because it shows how integral policymakers and all the different agencies actually contribute to whether you actually do better or you actually do worse. As we move on to March 2020, we see that the newly appointed Prime Minister has now announced a movement control order. Now, as we announce the movement control order, we see that all of the Malaysians are suddenly in shock. Nobody can go to work, nobody can move, nobody can go around. And when this occurred, everybody was suddenly afraid of what's going to happen. Because now they said, if the country was in total lockdown, something bad must be happening. But at that moment, we were unable to justify to the public why the lockdown needed to occur. Because we were actually trying to understand what was actually happening. We were trying to understand how this pandemic was moving in the country. We were trying to understand how severe these things could be. At this moment, we took the most extreme because we said better for us to move in this level than to regret not doing it. So when we did this, it was one of the most extreme in the world, right? We had the army coming out, we had all the police covering all the roadblocks, everybody was just at home. Nobody could go out. All the shops, all the factories, the whole Malaysian economy came to a standstill and it was on a total lockdown. And what occurred to us was how detrimental this thing was going to be to the country if we allowed it to keep happening, if we allowed it to keep occurring. So we said, this could not be allowed to continue. There must be a way for us to ensure that we can actually start living with this virus or start living our lives with the virus in the environment. So then we had two issues now. You had an old government and a new government. The old government thinking that they are still in power, the new government thinking that they know what to do, but in fact, nobody knew what to do. So now you had an issue where two different levels of government, which is the federal and the state, having their own ideas on how to actually solve this pandemic. So that's why I highlighted these two things. If you can see on the screen, you see that Malaysia has announced. So the federal government has initiated their own task force. And then the state government has also appointed their own state level task force. So you had the federation and then you had the state. So each negeri had their own task force to handle COVID. And then from the university point of view, what occurred was we started creating our own task forces in university. So the universities knew that we had the brain power to actually start thinking about what were the solutions that were actually available to the country to use. So now you had multi-levels, multi-different states and also agencies having their own task force thinking of their own solutions to the problem. So this is what's interesting in this pandemic and what I would like to highlight. So at the start of the pandemic, which is very much early on here, everybody thought they know best. Everybody thought they knew what to do. So everybody started doing what they think should be done. And this is where you had differences in opinions, and you had differences in the agenda on how to tackle the pandemic response. And then we move on to October 2020. Now, this is one of the most significant, the most devastating things that could have happened to a country who did not understand what was going on. So, a big state, which all of you know, Sabah, because we share the same island of Borneo together, Malaysia and Indonesia. You guys have Kalimantan, we have Sabah. And you know how big the island of Borneo actually is. The state government there fell. And they called for elections. They called for elections at a time when the country was told by the World Health Organization that COVID is actually not airborne. It is more of aerosolized or more of a body fluids kind of thing. So the imposition of masking and standard operating procedures was not done. We didn't do it. So then we held the Sabbah elections. And let me tell you that the elections went on because everybody didn't know what else to do. The whole country was just after lockdown. So everybody from the Peninsular Malaysia took flights and all of them flew to Sabbah. Now, when all of them flew to Sabbah, at that moment, we had quarantine rules, which means that we wanted to tell everybody that if you came back from the East Malaysia to West Malaysia, you need to be in quarantine for 14 days. But lo and behold, when politicians come into the picture, the 14 days became 10 days, 10 days became 7 days, and then suddenly it became no quarantine. Because they said we are in the same country, there's no need to quarantine, there is a low risk of that happening. And then we had the biggest wave the country could not have imagined. Our problems rose and shot 1 month after the Sabbah elections, and the country was on its knees. We really had no infrastructure to actually respond to. We were actually on our knees. And this is important. Why? Because I think what's important is for us to admit that we needed to be on our knees. We need to have our legs chopped off, then only we could understand how to walk again, right? So we were devastated. And it was so bad that even the Prime Minister then had to admit that because of the elections that were held, it caused the third wave that is completely devastated. And to be honest with you, our third wave is just trying and slowly dying down. It's still there until today. And it's been almost a year and we're still trying our best to fight it. Have we won? Of course not. Right. Then we moved to February 2021. And this is where we started to understand that the vaccines were ready and the vaccines were landing in Malaysia. So we bought all the vaccines that we could have. So we are a country that believes that we are very rich. All right. We are not rich, right? I just have to make that clear. But we always like to keep our options open. So we bought all the vaccines that the world could provide. And when it arrived, we started injecting our people. And to show that the vaccines were effective, we gave our Prime Minister the first dose. All right. Our Prime Minister is still alive, but he's no longer the Prime Minister. So the vaccines actually work. All right. So in February 2021, we started rolling out the vaccination program for the country. So we started off very slow. And then when that happened, because of the waves that was just keep on happening, we went for another lockdown in June 2021. So everybody at this moment thought, if we were rolling out vaccinations, how and why do we need to lock down again? And we did this because we couldn't control the relaxation that occurred. All right, the vaccination rollout was still extremely slow. We were still trying to pick it up. But then we started to understand that, look, we cannot just count on the vaccines itself. We must also have other sort of public health interventions for us to be able to understand what's going on. And the reason why we didn't do this earlier, as you can see, the then Prime Minister says that 1 billion is lost daily, and we could not actually sustain if we did not open up the economy even a little bit. Now, I'll show you, and the reason why this is all important and these key dates are important, because you will see how the trend actually works, and we actually get to that, and then you'll be able to relate how policies and all these things actually play an important role. So then we move to this month, which is the end of the day today, where the country of Malaysia actually recommends booster doses for all age 18 and above. Sinovac, AstraZeneca cannot be used. We always say that the vaccinations are one of the key factors, and we always promote about how important vaccination actually is and why it's actually needed, and why you should actually encourage people to take vaccination and the booster doses. Now, I would like to highlight and show you, if you remember the timeline, and you'll be able to see where we are extremely low during March. And when it was 200 cases, we went for a full total lockdown. So when we was on the full total lockdown, everybody said, wow, we are doing well, we're doing well, we're doing well. So this is when the awards went out. Everybody called everybody a hero. Malaysia is the best in the world. We have done it. We have achieved. We have conquered COVID. We are now the champions of the world. And then we did the stupidest thing in the whole world, which was to hold elections where we couldn't control it. And then we started seeing the spike. This is where the elections occurred in October. And then we started seeing cases touch 5,000 cases. And everybody was in panic, because here we were talking about 12 cases, 18 cases. And at this moment, when we see this dip, we had a big argument between the public health fraternity and the Ministry of Health. We said that this depression here occurred during this February period is false. Why? Because the number of tests that was done here was not the same as the number of tests that was done here. So remember just now when I showed you about the two task force between the federal and the state. So when the state task force, the biggest state in the country, the richest state in the country, Selangor, which I was actually heading, I took all the money, I bought so many RTK kits, and I said, let's go out and start testing people. Are you sure that this is a dip, or are we just not testing enough people? My narrative at this particular moment in time here, as you can see, was that if you do not test, then you will never find. If I don't test anybody tomorrow, my number of cases will be 0. It's very simple. So we started going out and we started testing tens and hundreds of thousands of people. And then we started tracing their close contacts. And then we see a spike here happening, because the contact tracing started to occur at this moment here. And we had like about a month of backlog of contact tracing. Started tracing, small dip. And then we said, you know what? As long as we are reaching for the sky, we might as well head for the moon. And that's where we went. So we touched the moon with our number of cases. We went up to 24,000, 25,000. And we said, you know what? This is actually what's happening in Malaysia, not this. This is the reality. But there was a saving grace for us. When this occurred, we started our vaccination drive here. And we hit the peak of vaccinations somewhere around June and July. And the effects of vaccination are seen here. And then we can see the dip in the cases with the vaccinated. And then we see here right now where our country is here. Now, as public health personnel, we always tell the government that after here, you will see it spike back up. All right. And we know this is going to happen because of the low uptake of booster doses. 40% of people do not want to take the booster doses. They say that they don't need it because they say they're not sick anymore. And we can see it happening there. And then we move to the number of cumulative cases. So we have now passed 2.65 million. Of course, we cannot compare to Indonesia because the population is big. And this is where we like to draw the importance of actually epidemiological reporting. From the very beginning, we have always said that you cannot report on absolute number. So if you look at the previous one, you see absolute number of daily cases. But what does it reflect? If I tell you there is 10,000 cases in Indonesia and 10,000 cases in Malaysia, are they the same thing? Of course they are not. Right? 10,000 cases in Indonesia is nothing compared to 10,000 cases in Malaysia because your population is 10 times bigger. Right? And this is where epidemiological science must come in and say, we must start looking at rates. What is the rate of infection? What is the percentage of population actually getting affected? And this is why it's important. When you get cumulative cases, how many percent of the country has been affected? Right? Because if you say 2.5 million of people in New Zealand have COVID cases, they only have 3 million population. So almost 88% of them are actually affected. But for Malaysia, 2.5 million is almost 10% or 8% of the population actually has had COVID-19. So it's very different. And this is why when we report to the lay public, to the population, it's very, very important to make sure they understand. If I tell you 10,000 people have COVID today, it's different than me telling you that 0.5% of the population has COVID. Right? Very different. So risk communication now plays a role. And this is where you start to link what policymakers actually want to show and lead the public. So in any pandemic or in any chaos or in any emergency, there are two things that you can do. You can make the public scared or you can make the public prepared. So we chose to make the public scared. And now you can see that when you scare the public, it can only last for so long. When you scare the public, saying that if you do this, we would this will happen. You only scare them for so long. After that, they will not longer listen to you because they are no longer scared. They become desensitized. So rather, they just go on doing whatever they want to do. And that's what happened in our country. And that's why now you see there is a falling rate of SOP compliance. There's a reduced rate of hospital compliance. And then now we look at the deaths. So in Malaysia, because we are a majority Muslim country, a lot of people did not get angry because we put a lot of it in faith and in takdir, and we say that because this is fate, because God has said that the end of the life of this person is here, this is why this person has passed away. But as you can see, that public health policy actually plays a critical role. When you see the spike occur, when you see the number of cases occur, you can see the number of deaths actually spiral and go up out of control. So what this and the previous number of cases actually show is the public health preparedness of so for Malaysia. You can see that we actually only have a limit which was here. And if you look at the previous, after you breach this mark here, you see the numbers going spiraling out of control. It is not these people were going to die anyway, but because we did not have enough ICU beds, we did not have enough ventilators, we did not have the public health and the hospital capacity to actually tackle COVID-19. And this is why we see a number of deaths spiraling out of control. And because of the vaccination rates, we can see that the number of deaths is now coming down. But they're still dying, about 50 every day, right? Is this a number that we want to say that it's okay? We don't know. Because as you move and talk about endemicity, you talk about endemic, you will see that there is a lot of issues about how many number of deaths you can accept a day. And then you talk about vaccinations. Remember in the earlier part, when I told you that if you look at this curve, and you look at this curve, this curve, all right, you will see that it correlates exactly the same with the rate of vaccinations. So as the vaccination rates increase, the number of deaths also decrease. But what's important to remember in public health is that the number of cases actually went down because of vaccinations, but not because of public health intervention. Now, this is something that is very critical. You cannot say that you have succeeded in tackling the public health emergency by just saying that the numbers are gone down, because the numbers go down because of vaccination, not because of your public health policy. Now, we are fortunate enough that the vaccines rollout actually came out 1 year after the disease came. And this was because of the breakthrough of mRNA vaccines and everything else. But what we have to remember is that we cannot be overly reliant on the vaccination itself. The vaccine is part of the solution, but the public health intervention and protocols is what we should focus on and what all countries must put in money into. It's not about developing faster vaccines, but it's about public health policy. It's about public health risk communication. It's about public health engagement. Now, you know that COVID can be prevented by just putting on your mask and limiting exposure, limiting interaction. If this was actually the case, we could actually solve COVID even without vaccinations. But we had to depend on vaccinations, which means that without the vaccines, in actual reality, our public health response was actually a failure, right? Because the vaccines doesn't show that you have good public health policies. The vaccines just show that you can inject people in their arms, that's it. Imagine if we did not have vaccines, how bad would the situation be now? And what would be different? We are thankful that the vaccines are here, but what if the Omicron variant does not respond to the vaccine? What if in 2 years we have another pandemic outbreak? Is our public health infrastructure ready to face the next one? And do we have policies in place? And this is what is actually critical, and this is what we actually have to think. All right. So I only have about 17 slides, and 12 slides have been very, very sad and very, very, what we say, very, very negative in a sense whereby it only shows the bad things. But I would like to highlight certain things that we actually did. So as you know, in Malaysia, we have our application whereby we are now trying to understand how public health policy can now be shaped to ensure that we are more resilient in the future, to ensure that we are more prepared for the next pandemic. And I'm more than happy today to share with you some of the things that we have done, so that perhaps this could actually trigger ideas. And my biggest aim and ambition is to actually develop an ASEAN public health response plan, an ASEAN integrated medical record. Because remember that Indonesia, Malaysia, Singapore, Thailand, and everybody in Malaysia, all the Malays who call themselves Malays in Malaysia, we all came from Indonesia. Like I told you earlier, my grandmother came from Jogja. We are all integrated in some sense, one way or another. We rely on each other for everything. So it only makes sense for us to develop something that benefits all the nations around our ASEAN region. So in Malaysia, we have MySejahtera. This is done by the federal government. So this is a contact tracing and also a reporting app, where it's a public health app that shows you what is your status, what did you do. But I would like to share with you what we actually developed. Me and the team actually developed together with the team from Sri Lanka. I will actually need to be able to share with you here. Can you see the screen that I'm opening? It's a black screen. Can you see it, or are you still seeing the PowerPoint? Can you see the black screen with the number, or you can see the PowerPoint?
Well, we can see in the PowerPoint, no problem.
You only see the PowerPoint?
Yes.
All right, I'll share with you another. Okay, now can you see the black screen?
We've seen it in the 19 cases in my
COVID-19 cases in Malaysia, yeah? Right? You can see my mouse moving, yeah?
Yes.
Right?
Yes.
Yeah.
Okay, all right. So this is what we'd like to share with you. So in the state level, we actually developed an artificial intelligence system to actually be able to help us in combating the public health pandemic. So this was actually done by Selangor state government. It is the richest state in the country. So definitely they have the most money. So as you know, actually the countries that do the most, or the country that is the most well prepared is the country that has the most money. The country that has the best rate of vaccinations is the richest countries. And even until now, that's why we see only about 8% or so of the African continent is being vaccinated because of the lack of finance and everything like that. So you need money for public health. So this is what we developed. And I think I shared it with Ibu Dewi just now. On this site, you are all able to access it. You can use it for your epidemiological classes, for you to be able to learn, for you to be able to do what are the things you want to do. So you're able to select all the states in Malaysia for this. So it has a timeline though, because it was until end of July only. After that, we moved to the federal database. So what you can see is that the daily incidents by state, we have cumulative cases, we have the cases fatality rate trend, and this was accessible to everyone because we wanted to make data to be seen by people so that they are more able to understand. But here you can see the number of cases. We can see how automatic contact tracing was actually conducted so that we can actually bring down the number in the state. And we can see that the number of people who actually scan using the QR codes actually help reduce the number. And the moment that when we move from the state program, this is yellow, and they move towards the federal, we can see the number of cases actually start shooting up. Because now that is not the state problem anymore, we have moved it over to the federal, so we are unable to do contact tracing. Here you can see how we map out, and we see how the number of deaths has occurred. You can actually click any of this, and it will actually tell you about what is the problem in that area, who was what are the things that actually occurred. And we did this because we wanted to let people have access to the data. Because as you know that as much as we talk about data and all these things, we wanted to make it easy for people to understand. So you can see that here, you can see the incidence of data, incidents registered, how the diagnosis announcement are not by state. And we keep telling the government, R0 is not only the only indicator that you can use. R0 doesn't mean anything. You tell everybody every day the same R0, it doesn't make a difference because it doesn't show or reflect anything, right? We show here the data on the incidence rate and the cumulative cases. And what I'm trying to explain to those of you who are listening today is that more than ever, it is extremely important that we have to move to a digitalized healthcare system, healthcare platform. Everything needs to be done as quickly as possible. We need to be faster than the virus. We need to be faster than any outbreak. We need to be faster than any of these other things so that we are a step ahead. Remember when we have a curve in the epidemic curve, and we always say, we need to flatten the curve, we need to flatten the curve. You cannot flatten the curve if you are always climbing it. You cannot flatten the epidemiological curve if you're always behind it. You must be ahead of the epidemic curve so that you know where the direction is going to go, and before it can go up, you can already suppress it down. That is how you bring down and you flatten the curve. So we also did some SER models. I think this is the reason why I'm showing this because some of the listeners are epidemiological students, and I think it's very important that you learn how to actually take data and actually use it for you to see how important it is to actually digitalize and actually bring the data together so that people will be able to understand. I shared that with David just now. So I'm going to keep sharing the screen. All right, now we are back to my PowerPoint presentation. Am I right? Dr. Budi? Nampak kan?
Yes, nampak. Okay.
Okay.
Yep.
So when we talk about coordination, as you know that there was a lot of things that you cannot do alone. No matter if you read my CV, oh, I've done this, I've done that, done that. That's the only things to highlight. the things that I participated. But the responses that we did was in the hundreds of thousands of people. Sometimes 2,000, 3,000 people to solve one area, 4,000 people to solve one area. To say that you are the reason why the pandemic has resolved is a fallacy, because you are not telling the real truth. So no one person actually can solve the pandemic alone. So that's why we did a lot of the volunteer coordination with my Ohun, which we integrated all the universities together. And we took all the public universities and we put everybody into one circle. So remember in the earlier part of my lecture when I said about how everybody wanted to do it on their own, we started saying, you know what, why don't we put everybody who's different into the same room so that we can come up with the same sentence. We can come up with one idea. We can come up with one solution. And this is when we started seeing the change in how the pandemic response actually occurred. When we started working together and everybody's understood that there should only be one leader and everybody else play their role, then we can see things actually moving, things are actually happening. So we played a lot of part with the NGOs and also the general public. So we had the fashion designers design our PPE. We had the tailors actually sew all our PPEs. So all these people did it and none of them asked for money. So none of them got paid. So I don't know whether it's forced labor, but actually it's part of patriotism. Everybody did their role to actually together work into overcoming this pandemic that was actually happening in our country. I'm just going to highlight you one of the things that we actually did. So one of the biggest things that actually was an issue for us was the refugees. So when we talk about partners and interagency coordination, this is where a lot of the universities, the Ministry of Health, the police, and also the UNHCR, we work together to actually extend our reach to the refugee communities. Because a lot of these people were actually forgotten. We fought to ensure that these people will actually get free vaccinations without being caught and reprimanded. No matter who they are, as long as they get vaccinated. Because no point you vaccinate your population, you don't vaccinate refugees or the illegals. Because the people can still spread the virus. Right? The virus knows no bounds. And together with the American aid for development countries, and together with Ohun and Mahun, we actually developed COVID trainers kit and actually went out to the populations to actually ask them to learn about COVID. We went down to the ground and we made videos, we made sessions, engagement sessions, so that these people would actually be able to understand and comprehend what was actually happening. So one of the videos we did was something like that. We made it interactive, made it as easy as possible. So we wanted to educate people. We wanted to show them what was the symptoms, what was actually happening, and we did this by translating all of this into the different languages. We have in the Rohingya language, we have it in Myanmar language, we have it in Bahasa Malaysia, we have it in Mandarin, we have it in Tamil. So we wanted to go out and get it out to the message to the people that the only way that you can actually overcome a pandemic is by ensuring that everybody works together. That in no circumstance will you be able to achieve what you aim and target for if you do not work together. So these are just some photos of engagement sessions, of going into the jungles and into the villages in Malaysia, doing the COVID-19 testing. And this is a very, very, very small part of a bigger picture, right? Of a bigger picture. And what we understood was engagement and reassessing and having engagements with people was what is going to help us in our pandemic response. And without having the ability to work together, without having the ability to have interagency coordination, without having the ability to relate all the things and come up with one simple solution, you will never be able to achieve what you want to do. And the country of Malaysia has seen, I have to count because there's just been too many, 3 different prime ministers in the span of COVID-19. We have had 3 different health ministers. We have had policy changes occur along the lines. But what was important is that no matter how the changes occurred, the most important was that the policy of the public health experts must not be challenged, because policymakers will only be driven by the politics of it. But the public health will always stick to the science and the data. And what is critical that we have learned in this pandemic is that when you do not follow the data and the science, if you deviate from the public health science, you will definitely fail in your public health response. With that, Dr. Budi, I would like to end my talk because I would like it to be an engagement session. And I think it's best that we exchange ideas and we answer as many questions as much as possible. Thank you very, very much.
Thank you, Professor Farhan. I think your presentation is very good, and also it's brief, give us brief presentation about the effort of Malaysia. While we are waiting for the discussion, actually your time is still long because we prepared your time until 11, but it's okay because I know that discussion sometimes is very important for us. I will ask you some question. Firstly, about the Malaysia awareness to existence of COVID. It's began in the January of 2020. It's much earlier than Indonesia. The question is there any the role of the public health officer or scientific officer to set up our advocation about the science or maybe data about in the Malaysia, because at the time in Malaysia maybe still low, but in the January 2020 it's become a national effort.
Okay.
Yes.
So what you must understand is this, yeah. Most of the public health brains or the experts are in the Malaysian universities. The public health in the Ministry of Health, most of them are implementers. So they work. They are more like administrators. And that is why early on in the beginning, the university wanted to ensure that data was not compromised, because we knew data was going to be a problem. Because you needed someone whose only role was to watch and look at data. When you do not look at data and you look at it as second, macam anak kedua ataupun bini kedua, not macam bini pertama, it's going to be a problem for you. Because why? Because when you leave it to the public health implementers in the ministry, they are busy with the pandemic response. So they are not going to pay particular attention to the data itself. So we had to fight to ensure that data was actually going to be done, but it was extremely delayed, Dr. Budi. We had a delay in trying to tell the government that, look, data is what is going to save you. If you do not have data, you will not know where to go. If you do not have data, you will not know where to respond. You will not know who to send, how many people to actually come. So this is where we told them, we will handle the data. And that's when we actually started and set up our data center for the COVID-19.
Yes. Thank you. You wrote about the fights, how to fight with the data to become a national effort. It's the struggle of the public officer like us. Maybe you can give the point on this guy.
So when we talk about fighting for the data, to be honest with you, at the very beginning of the pandemic, they only gave data which they wanted to give. Yeah, so they only give data which they want to do. So the government will say every day at 5 o'clock, today we want to announce there is 300 cases. Today we want to announce there's 250 cases. But we were asking, who are these cases? Are they, what ethnicity are they from? How old are these cases? How is the distribution? Where are the cases from? Where are the cases? And what is the category of the cases? So we actually held a team. We wrote a letter to the Prime Minister of Malaysia then. I cannot remember which one, 3 of them. I don't know which one we wrote to, but we wrote to one of them when he was Prime Minister. We said that if you do not allow data to be given to us, access to data to be given, you will definitely fail and we will go against what you are trying to do. So we sent that letter. So the Prime Minister responded by saying that, okay, I would like to form an expert advisory group to the Prime Minister so that we can do it. So we went through the backdoor channel and asked and demanded for it. We went through the media, we made people question the government. Give us the data. We want to know. We actually made the people knowledgeable. What is it that they should actually be asking the government? No longer should they only be asking about number of cases. They should know more and more. And to be honest with you, Dr. Budi, the time that we had access to the full data was only in September 2021. Only in September, which was 3 months ago, we had access to all the data. Prior to that, we had no access. We had minimal access. But like they say, better late than never. But obviously, if the data was given to us much earlier, we would be able to handle it better and give them better strategy for them to handle the pandemic.
Yes, okay. Adik-adik para mahasiswa pasca sarjana Undip. From this topic, we can see that the data is very important, and then using the data, menggunakan data ini untuk advokasi kepada Prime Minister, pada pemangku kebijakan, itu adalah sesuatu yang kemudian jauh lebih penting lagi, sehingga menjadikan data-data atau kasus yang ada di lapangan ini menjadi sesuatu yang bisa menjadi bahan kebijakan-kebijakan di tataran politik. Nah, inilah yang menjadi problem di tempat kita dahulu ketika data itu belum begitu kuat, kemudian kita berusaha menutupi bahwa Indonesia mungkin nggak akan terkena COVID karena kita suka jamu, karena kita punya doa yang banyak, karena kita punya masjid gereja yang banyak. Ini sesuatu yang sebenarnya bisa dibuktikan oleh sains public health bahwa itu semuanya adalah penting, tetapi tetap data-data itu menjadi sesuatu yang sangat penting sekali. Okay, I invite you to ask or maybe have a question. Ya, ada mahasiswa yang bertanya atau hadirin semuanya.
Di chat ada, Dr. Budi. Di chat group ada.
Ya. Oke, di chat, ya saya lihat. Boleh yang bertanya di chat atau langsung boleh? Raisen boleh, Raisen? Ini ada dari Erwan atau Mr. Farhan, Rusli. I wanna ask you, are there any special tips from Malaysia to deal with the variant of COVID-19 from South Africa called the Omicron variant? And recommendation or any health protocol we can learn from Malaysia? Thank you. Silakan.
I think what is important to remember, always to remember, whenever there is a new variant that comes out, Malaysia knows as much as Indonesia. Indonesia knows as much as Singapore. Singapore knows as much as Thailand. So it's something that is very new. But you must remember the basic fundamental of public health. regardless of the variant that we actually come, let it be Omicron, Sigma, whatever variant that comes, it boils down to the basic public health response, which means basic in terms of public health prevention. You know that whatever is the variant, you can prevent it by using masks. You can prevent it by having social or physical distancing. But to ask whether it's important for you to actually have any border controls. So Malaysia has now said, okay, we don't allow 7 countries to come into Malaysia. But you must remember something. All right, you must always remember this. When you say you don't allow 7 people from these countries to enter, these people can enter any other country. When they enter any other country, let's say they go to Dubai or Qatar and and they're in transit, they can pass the virus to somebody else there. That person comes in to Malaysia. They are not from the African countries, right? They come in and they bring the Omicron to the country. So that's how Delta actually spread, everything actually spread. So you have to think, when you want to make policy, when you want to say you allow this or don't allow that, you must look at the public health aspect of it. Is it actually going to help prevent? What is more important? It's about testing. It's about quarantine. It's about separating people, whoever comes in. Now, as you remember, Malaysia and Singapore, today or yesterday, we opened up our vaccine travel lane. So Malaysia and Singapore cannot cross each other for those who are vaccinated. But people from Singapore can travel overseas. They can come back with the Omicron variant, pass it to somebody who's Malaysia, Singapore traveling, and that can bring back into Malaysia. And these people don't have any more quarantine policies, right? They test, but you know that testing is only valuable up to a certain number of days. So this is where you have to re-understand and make the policymaker. You must go back to basic public health rules and policy. You must go back to basic public health protocols. And your question, whether we should upgrade laboratory and everything like that, of course, we should increase genomic testing. We should actually try to find what are the variants that are actually around us. And you cannot say that you found 300 Delta because you only test 3,000 people. It doesn't give you an overall picture. You must spend on laboratory testing and you must do it. Like I keep saying from the very beginning, if you don't test, you will never know. How do you know that it's Omicron or not Omicron, right? How do you choose who is Omicron, who's not Omicron? And if you keep missing the people, you will never know that it is here until it has spread around the country. And as you know that the Omicron variant actually has 32 different mutations to the spike protein. And you know that this is extremely ineffective with the vaccinations that we have now. So you must detect it early before it spreads like wildfire, just like the Delta variant. And one of the things that you must remember, the WHO has very quickly put Omicron under the variant of concern, not variant of interest. And it was extremely fast. The Omicron VOC has been released even faster than the Delta variant. And you must know why the WHO has done this. Because they know that if this spreads in countries, even with those with completed vaccination, that it would be extremely ineffective against those people. So you are right. We have to increase laboratory testing and we have to keep testing more and more. Thank you, Dr. Budi.
Yes, thank you. I think in the presentation you say about the automatic case finding in the field. You say about automatic case finding or maybe automatic tracing. Can you explain about this? Thank you. Because it's correlated with this question.
So when we talk about automatic case finding, it's actually using artificial intelligence. So we have platform systems. So I will show it to you to make it easy for you to visualize. And I think, I don't know whether you guys are able to see it. So this is the app that we have in the country. So this app actually shows us what's there. We have our vaccinations, we have everything in a digital passport. So in the digital passport, what can actually occur is this. With the digital passport, I am suddenly COVID positive, okay, everybody who's been into the area where I am will get a notification that you have been in contact with a COVID positive patient, but your contact is less than 15 minutes, so you are considered as a casual contact. So you can go on and work as normal, but if you get symptoms, please test yourself. It can also detect if I have been close to one another for more than 15 minutes, which means I have a long-term exposure to the person. Automatically, the person will get a scan on his phone. It will be updated that he is actually a close contact. So when you are a close contact or you are a positive patient, your phone will be red in color. So when your phone is red in color, you are not able to enter any premise. I cannot go to the supermarket. I cannot go to the school. I cannot go to the shopping center. I cannot go to the petrol station because I cannot scan. If I cannot scan, it will sound an alarm on my phone saying that you are close contact, you should be at home. And it's designed in such a way whereby if you are a close contact and you are a positive patient, your automatic quarantine day will appear. And if you move, I think 50 meters away from your house, it will send an alert to our system saying that this person has moved from his quarantine zone 50 meters away. So he's breaking protocol. So you will get a call saying, hello, sir, we know that you left your house. You either go back or we send the police to you. So they will be notified like that. So now we did that because in the country that you cannot move around without your cell phone. So that is how we actually moved it to automate it to make it much faster for us to detect cases.
Yes. Yes, thank you. It is a lot achievement about the digital technology, and actually in Indonesia, in some places, some organization try to promote this to national, but however, until now the national committee of COVID-19 still didn't use it yet. Because maybe about the Indonesia too large, or maybe too many islands, or maybe anything. But it's in some places, some non-government organization try to promote this in Indonesia. But however, until now, Indonesia National Committee didn't use this protocol for preventing.
You can ask them to call us, Dr. Budi. We will give it to you very, very cheap. And roll it out even tomorrow and next week, no problem.
I know. That is the challenge to health officer like us, to advocates. Prof. Rusli once again said it's so cheap. We just do it, and it will good for Indonesia. But until now we still not. Makanya adik-adik semuanya, students dan health officer yang peduli dengan COVID, ayo kita bersama-sama dorong bahwa digital effort automatically ini seperti ini harus diberlakukan. Karena apa? Kita masih ingat kemarin ada orang yang masuk ke isolasi baru 4 hari dia keluar, bahkan diizinkan keluar oleh petugasnya. Sehingga menjadi skandal yang lucu sekali yang katanya hanya bisa berlaku di Indonesia. Ini contohnya. Ya, ini bukan masalah pelanggaran hukum saja, ini masalah public health advocation kita yang kurang kuat. Oleh karena ini kita semuanya student public health ini kita harus menguatkan advokasi kita, sehingga seperti kita katakan tadi dikatakan oleh Prof. Rusli bahwa fighting itu di sini kita harus membawa data, membawa bukti, membawa risiko scientific ini kepada decision makers, betul Pak Rusli ya. Nah inilah poin kita untuk bukan hanya sekolah di kampus, tetapi how to advocate everything ya. Terima kasih. Ini ada pertanyaan lagi dari Pak Ignatius Gonggo. Malaysia is a federal public policy, have Sarawak and Sabah. How can manage and any differences cases in the two places?
Okay. Sebelum saya jawab soalan tu, Dr. Budi, izinkan saya to elaborate. on the previous one, Dr. Budi, because when
Yep.
the pandemic started, I was just like that. I was in the university, just nobody, just staying in university doing work. Tapi sebab keinginan, kemahuan nak data itu, kenapa mereka tidak mahu berkongsi dengan kita kan? Kenapa they don't want to share? Kita ketuk pintu kecil dulu, lepas tu next pintu lagi besar, pintu lagi besar, pintu lagi besar. Sampai pada penghujungnya, ketuk pintu Perdana Menteri dan kata kepada dia, you have to listen to me. You have to listen to us. You have to know what is important. So, we may think that it's impossible for us to reach Presiden Jokowi, but it is actually not. Because I ketuk pintu tu mengambil masa 1 minggu sahaja sampai ke atas. Ketuk. Tapi hari-hari ketuk lah, ketuk sampai ke atas. And kalau kita menyampaikan benda yang penting, benda yang benar, they will listen and they will understand. And I think it's very important for us to tell all these public health specialists to be that actually what you think actually is very important. It actually matters. And you have to tell the right things to the right people, and you will get there. You will get there 100%. All right. So to answer this question, because Malaysia has basically divided into 3. We have Peninsular Malaysia, we have Sabah, Sarawak on the island of Borneo. Sabah and Sarawak is a bit unique. They have well, it's not autonomous government like in Papua. Papua has a bit of autonomy kan? If I can remember. But the state government only has certain limited powers, but the idea or the policy will come down from the federal government. So the federal government will tell all the state health director, because all the state health director is appointed by the federal government. So the policy is always the same. So the states will move in unison. We will tell everybody, this is the plan. Everybody will do out the same plan. We tell everybody, okay, everybody, quarantine is 14 days. Everybody will impose 14 days quarantine. So Sarawak cannot tell us, I want quarantine only 10 days. Oh, I want quarantine only 4 days. No, it's not. When we say it's 14, it's 14. When we say it's 10, it's 10. So it's to make sure that there is uniformity in the whole country from all the different states to ensure that people understand. Because Malaysia actually very, very small, very, very small, very, very tiny. So we don't want people to get confused. So the synchronization is also digital. So Sarawak, Sabah, everybody has to update their cases online to us. We have a big CPRC where we monitor all these things. I invite all of you, if you have the time, to come over. I will be more than willing to bring you and see our pandemic response centers, no problem. So that you will be able to see how we actually coordinate the different Ministry of Health states to ensure that everybody is the same. They follow the same plan and the same policy.
Yes, thank you. I would like to highlight this point. Firstly, ketuk. I want to inspire for our audience that ketuk is a kind of advocation, and advocation it means can be done by everybody, not only the great organization, but everybody. If you want to ketuk, now it's very possible, because you know that President Jokowi or maybe Gubernur Ganjar or anything, they already have a Twitter or maybe have Instagram or Facebook that you can meet them every time. And if you want just one person, maybe sometimes ketuk sekali kurang. Tapi kalau if you have many people who have similar ketuk, similar advocation, I think it's become a point that can be accepted to be kebijakan nasional seperti itu. Nah, inilah sekali lagi poin bahwa public officer seperti Anda semuanya sangat berperan di dalam merubah kesehatan di suatu nation Indonesia ini, seperti itu. Oke, ini ada pertanyaan lagi. Bagaimana ini about the Malaysia effort, particularly in the preparedness about the new COVID strain Omicron strain. The strain of Omicron that now affected the world. How preparedness in Malaysia? From Nur Idayanti.
Saya rasa yang ni sudah jawab tadi kan?
Yeah.
If I'm not mistaken.
But the specific words for
Airport?
this, yeah, specific word from this question to Idayanti.
For the airport, yeah, I think what we have done is that we have created and worked with the private labs in the country. Kita dah set up di airport. So siapa yang fly in sekarang automatically akan di swab and di test PCR testing. So PCR tu siap dalam masa saya rasa paling lambat pun 40 minit. Sebab kita ada mobile laboratory and mobile expert di airport. Ini untuk memastikan bahawa sesiapa yang datang, whoever comes into the country, we are going to make sure that they are negative. So they have to test before they fly and they have to test when they land in the country.
Yes. Okay, thank you. Thank you, Idayanti, for your question, and also this answer is very clear to highlight about your question. Mr. Farhan, Finian asked about the possibility using the digital automatic alarm or alerts in Malaysia, because Malaysia have not too many islands like Indonesia. However, in the some Sarawak, maybe there's a isolated area that who can use the digital alert to the remote area.
Okay, so if you want to know something, what I would like to share, most of the people in the villages and in the kampung, if you leave them alone, they will be happy and nothing will happen to them. All right. People in the kampung get disease because people from the bandar, people from the cities go and kacau. We are the ones who actually go and disturb the ecosystem that's there. So I think the question is in two parts. One is on the smart technology and the other is on the remote islands. So this is how we are doing it in Malaysia. So in Malaysia, we actually don't have any more GPRS. I think the basic minimum now is 4G because we're transitioning to 5G. And 4G coverage, I think, is almost 98% in the country, even in Sabah and Sarawak. We also use our cell tower and our Bluetooth proximity. So what the app actually does is that it can actually detect which cell tower you are connected to, and it can actually triangulate your position if you don't have any data. But if you have data, it will give you your GPS location. If you have Bluetooth, it will actually detect on Bluetooth proximity. So you don't have to buy anything new for it. So Singapore, they use a dongle they wear on their wrist or they hang on their neck. It's a Bluetooth dongle. So the moment you have interactions with anyone, it captures the Bluetooth connectivity. But in Malaysia, what we do is that we use the Bluetooth that is existing in your phone to capture. So if you know, even if you have a smartphone, last time we used to have Bluetooth even without smartphone, right? So that the old phones with the Bluetooth we can also capture. But for the places like in the islands and in remote areas where they don't use smartphone, for example, and all these things, we are actually trying to get them to carry a small bracelet. We are still thinking on how to do it. Whether these small bracelets can be their Bluetooth connectivity, so that when they come into the shopping center and everything, we can capture their movement. It's not to say that we want to be a socialist or a communist country where we monitor everybody, but rather we tell them that this is only triggered if there is a positive case or if you are a close contact, for example. So we will not access data if we don't need to access data. Data is only accessed if you are a close contact. And actually, to be honest with you, because the data is so much, we are unable to actually search for one person. So because of how the system is being designed, it is completely automated. So the alert to the phones, the alert to the application, all of that is automated already. So we actually don't have so much control over what data actually is being screened. So that's how we do it. And for the remote areas, the areas where we don't have any phones and all those things, we just do periodic screening for them. There's nothing too much that we can actually do beyond that.
Yes, thank you, Mr. Farhan. Digital technology for COVID is very important, and now become real that can be used in the public health effort to manage the spreading infection, not only COVID but also the other infection if we use it. And in Indonesia, it's still not developed much. However, some area, some NGO try to propose this this effort to the government, but still not yet be accepted. However, it's our homework to promote this effort to government. And in Indonesia, about the automatic searching in the lower, that is manually, that is automatic tracing. It's very important. Seperti kita ketahui di Indonesia, setiap ada kasus itu harus dilakukan tracing. Dan kemarin kita melihat bagaimana di beberapa puskesmas yang menjadi istilahnya menjadi pemegang amanah melakukan tracing, kita bisa melihat ada kasus di mana tracingnya masih cuma sekitar 2, bahkan cuma 1. Artinya apa? 1 orang baru bisa di tracing kontak close-nya itu cuma 1 atau 2 orang. Ini menunjukkan angka yang sangat rendah sekali. Bisa seseorang yang terkena COVID itu tracingnya bisa 35. Bahkan idealnya dari 35 ada 10 orang yang high risk untuk dilakukan testing dari tracing ini. Tapi dari angka-angka kemarin yang kita dapatkan di laporan, kita bisa melihat masih kurangnya. Ini adalah homework PR kita semuanya, bagaimana mendorong pemerintah untuk menggerakkan officernya, puskesmasnya, supaya melakukan tracing yang benar. Meskipun kita belum sampai pada digital alert, tetapi misalnya tracing yang benar ini otomatis akan mengurangi risiko penularan di lapangan. Barangkali saya sedikit menanyakan apakah tracing pasien, tracing close relation itu di Malaysia dilakukan juga, dan bagaimana caranya, Pak Farhan, kalau boleh tahu?
Jadi macam mana yang part akhir tu Dr. Budi cakap bagaimana yang tu?
About the tracing, yeah, automatic tracing. When people suspected infected the COVID-19, automatically health officer, the public health officer in the field harus melakukan suatu tracing. Orang ini jumpa dengan siapa dan sebagainya, dan itu harus sekitar 35 dan 10 diantaranya harus testing. Itu adalah sebenarnya petunjuk yang standar, tetapi kadang-kadang berkurang. Lah ini di Malaysia apakah sudah dilakukan hal yang sama?
Yeah, so pada peringkat awal, in the beginning, we actually had a lot of backlog because a lot of it was manual, extremely manual. Pakai Microsoft Excel, extremely manual. So we said this is something which cannot be left to manual because you don't have enough human resource. Tak cukup tenaga sumber untuk laksanakan.
Yeah.
So we move to digitalization. So when we move to digital, automatically even the officer is just notified you have a case, this case. But masa the officer now is being notified that there is a case, orang semua yang close contact sudah dapat notifikasi di dalam aplikasi mengatakan bahawa mereka adalah close contact, sila ke fasiliti kesihatan berdekatan untuk melaksanakan ujian RT-PCR. So kita sekarang moving to same day detection, same day contact tracing untuk memastikan kita boleh stop the outbreak and not waste time untuk menghabiskan tenaga sumber untuk telefon. So benda ni semua kita buat secara automatik.
Excellent. Luar biasa capacity of digital technology. So adik-adik mahasiswa semuanya, ini inspiring bagi Anda semuanya untuk membuat suatu tulisan tentang ini untuk bahan advokasi, bisa nanti dimasukkan di koran atau di Facebook Anda dan sebagainya, sehingga harapannya nanti ada kebijakan-kebijakan nasional yang bisa mengadop ini. Ini PR kita semuanya, dan tadi disebutkan oleh Prof. Farhan Rusli bahwa memang kita punya puskesmas di setiap kecamatan, tetapi terlalu berat sekali untuk melakukan secara manually, sehingga digital tracing adalah keniscayaan yang harus kita lakukan. Dari mana kita memulainya? Memang banyak advokasi, tetapi outputnya sampai sekarang belum. Mungkin ini menjadi advokasi atau PR kita, public health officer, yang punya amanah untuk mengingatkan masyarakat untuk melakukan advocacy ini. Ya, terima kasih. Ada pertanyaan lain? Adik-adik barangkali bisa langsung juga bisa raise hand. Barangkali ada yang raise hand. Atau ada yang tidak saya lihat raise hand, boleh langsung. Ya. Oke, sambil menunggu teman-teman ini raise hand atau menambah pertanyaan untuk Prof. Rusli, saya ingin menanyakan ini. Digital tracing ini sebenarnya memang suatu loncatan hikmah yang sangat besar COVID ini bagi umat manusia. Kita sekarang bisa mengetahui penyakit-penyakit menular lebih awal. Dan tentu saja, in the developing countries like Indonesia, a lot of infection disease become the problems. For example, typhoid, having no toilet, yeah, and also malaria and others. We still have no alerts for this case. And in Indonesia, we have no too much klinik wisata, sehingga kita tidak tahu kita masuk ke daerah ini, daerah malaria atau bukan, daerah demam berdarah atau bukan, dan sebagainya. Saya kira ini bisa digital informasi ini bisa menjadi semacam penguatan kesehatan secara umum di masa yang akan datang. Bagaimana, Prof. Rusli?
Macam mana Dr. Budi?
Digital information like a COVID alerts dan sebagainya ini in this case we can use this technology to the other cases in infection disease in Indonesia or maybe in developing country.
So I think what is important is this, yeah. When we move towards digitalization of public health, this is why I keep stressing. Believe me, I'm trying to push. We need an ASEAN public health. Kita perlu satu public health digital app untuk ASEAN. It can be an ASEAN digital passport. Vaccination, apakah semua ada dalam tu. So di mana-mana saya pergi, it will be seamless. Siapa-siapa saja boleh gunakannya. So kalau kita tengok, kalau aplikasi seperti Grab masih lagi besar kan di Indonesia, is widely used kan Grab.
Yes.
So kalau Grab boleh melaksanakannya, kenapa kita tidak boleh gunakannya untuk kesihatan awam kita? Kenapa kita tidak boleh berborak ataupun berbincang dengan pihak-pihak swasta seperti Grab untuk mengatakan boleh tak kalau masukkan satu lagi function di dalam aplikasi kamu, iaitu health passport ataupun sebagainya dan sebagainya lah. So kita tahu mereka ada wide network dan coverage. Dan kenapa benda ini penting? Apabila kami melaksanakan kami telah kendalikan perkara ini di Malaysia, we see that there is a great importance that this must be rolled out for the next outbreak, whatever is the outbreak. We are not talking about COVID only. We are talking about dengue. We are talking about cholera. We're talking about typhoid. All other types of disease, kita boleh gunakan this type of mechanism for tracing. And we are planning to move and integrate our digital health application to be an EMR, which is an electronic medical record. So this electronic medical record you can use in any hospital, any clinic, any center, so that you don't have to ask mana X-ray, di mana CT scan, di mana MRI, apa blood result. Semuanya ada di dalam digital app ini. Dan we think that if we move this to the ASEAN level, everybody now will be able to carry and they can seek treatment from anywhere. Because you kena ingat ya, orang Malaysia pergi ke Indonesia sakit juga, orang Indonesia datang Malaysia sakit, orang Singapura pergi ke Thailand sakit, orang Thailand datang Malaysia pun sakit. Di mana-mana kita boleh jatuh sakit, di mana-mana kita boleh pergi ke hospital, dan di situ adalah amat penting untuk kita tahu sebenarnya apakah sejarah kesihatan. What is the medical history of the patient? So we are moving towards that, and we think that it is important that you cannot move only in your country, because you can see in the pandemic, whatever happens to you happens to everybody else. So we must move together. And I hope that Indonesia will actually plan and also roll it out, because technology is very, very cheap, right? Because everybody use their own phone, everybody use their own data. It's not the government paying for your data, it's not the government paying for your internet, you are paying for it. So it's actually shared with the whole population, and it's something which is very good for you to invest on, because it actually helps a lot of people.
Okay, excellent. Yes, just a few days ago, we read in the newspaper about the data, how many people in Indonesia having smartphone, and more than 200 million people in Indonesia having a smartphone and then active in the sending messages or maybe social media. It is a good point to us public health officer in Indonesia, and inspiring you all the public health officer and students, that it is a point that we can promote the digital information to increase the awareness about the health, not only the COVID but also the others. For example, when we want to go to, for example, in the places of Central Java Province in Semarang, there's some public health officer, public health office noted some places high risk of dengue fever and also malaria. When we come to this place, similar when we are entering the airport. For example, we are in the airport of Soekarno-Hatta. Sometimes the advertisement come to our smartphone. Please, you can visit in the airport. The coffee that's so very nice. The coffee of blah blah blah, the others. This case, I think we can spend it to give the alert to the people when to enter to the places that high risk about the malaria, high risk of the typhoid. They can aware, and then they will do something to prevent it to become sickness of them. Ini sesuatu yang sangat menarik sekali dari COVID ini. Meskipun kita banyak terdampak, kita bisa punya punya semacam hikmah untuk kita bisa meningkatkan public health standar kita. Di Indonesia ini public health standar kita masih banyak yang kurang. Minta maaf, ini kebetulan Undip bersama dengan relawan-relawan dengan mahasiswa, kita mempromot sesuatu yang sebenarnya di Malaysia mungkin tidak terlalu populer, yaitu promote toilet for all family. Because I read that in Malaysia almost all family having toilet, but in Indonesia some of them still motion in the river or also in the garden or anything. This is can be data. For example, in Semarang, 21% have no toilet. So we should aware that risk to be affected with typhoid or maybe the other gastroenteritis increase in this place. So please, you only eat or drink the supervised production water or maybe food like that. Ini sesuatu yang saya inspiring anak-anak, adik-adik untuk membuat semacam tulisan, dan saya kira kalau tulisan ini dari 200 lebih audiens yang ada di sini mempunyai hal yang sama, pentingnya digitalisasi dalam pembangunan kesehatan masyarakat, dan kita nanti bisa kompilasi, kita kirimkan ke Pak Jokowi, saya kira bisa menjadi pertimbangan untuk menjadikan digital teknologi ini menjadi salah satu yang bisa dimasukkan public health effort kita. Ada pertanyaan lagi kah?
Good morning, Dr. Budi. Good morning.
Yep. Yes. Okay. Oh, Aldi, thank you.
Thank you, Dr. Budi. And I know how you struggle to fight and to make better about gastrointestinal infection because I involved to this program with you. We have struggled for many years about to fight
I brought
this.
to you too.
It's very glad
because
to see you again.
You the volunteer to family to having latrine. Thank you.
Yeah. Okay, Dr. Budi, thanks the opportunity that given to me, and I want to talk with the Pak Farhan Rusli. Good morning, Pak Farhan. Selamat pagi. My name is Aldi, and actually I clinical at the hospital. So in COVID problem, I directly face to face with the patient. I directly gave a care to the patient in the hospital because I work at the hospital and give a care in patient in the intensive room. So I want to tell you something about this virus, this infection COVID in Indonesia. Maybe we know that some Malaysia and Indonesia has a similarity culture, has similarity tradition. The one of that is Idul Fitri, Christmas celebration, Chinese New Year celebration. That we know that many people and in urban the tradition back to hometown. When the people go to the city, the big city like in Indonesia, many people go to Jakarta to get the job, get the salary, and in Idul Fitri they back to their hometown to meet the family. So in Indonesia we get the peak infection of COVID is around at July and August 2021. So maybe 4 months ago in Indonesia, so win here. That so sad to tell about this story because in July and August, all of the hospital is full. All of the isolation room is full. Many people die in home when they have COVID and they cannot access the isolation room in the hospital. This is so sad story, just and we will face the Christmas after this in December. You know that in Indonesia, when the peak infection happened in July and August, it's occurred because many people back to hometown get spread the infection from the big city in their town. Then so it's just like have a really fast infection in their town, and we must avoid this happen again. Actually,
yeah. Ini lagi ditransferin ke bendaharanya. Saya lagi seminar sebentar ya.
We must avoid this happen again in December because we know that in Christmas and when New Year, people will back to home to again. So the government always make a policy that nobody can go home. For especially like government employment, ASN, and many employment, and it's for all of the people that government have the policy to prohibit, to forbidden people to back to their town in Christmas and New Year. But I think it's not enough to avoid to make the spread infection can stop at all. So what do you think that we can do about this? Not only based on policy government. Thank you, Pak Rusli.
Terima kasih Aldi. Thank you, terima kasih. Jadi what's important to remember is this, the government basically will just tell you whatever they want to tell you because it's what they need to tell you. It's very different, right? So the government will tell you you cannot drive fast on the road, correct or not? You cannot drive fast. If you have a car on the highway, you cannot drive after a certain limit. So you cannot drive fast. That's what the government will tell you. But how many people will drive fast on the highway? Many, right? Many people. That's why everybody has an accident, they die on the road. The question that you must ask yourself is, do you depend on the government to tell you what to do or not what to do? But is it better for you to focus on making the public understand what is actually important for them? So now this goes back to basic public health principles. And one of the most critical and always neglected is actually health promotion and risk communication. So when you talk about education and educating the public on what is important, is very different than telling the public what to do, right? Rather, the public will say, for me not to get into an accident, I'll have to drive slow. So if you look at the data of COVID-19, and I take the data from Malaysia, the number of transmission that occurs when you cross border, balik kampung ke bandar, bandar ke kampung, is only 1.8% of total number of cases. Very, very low. It's actually not when you cross balik kampung that is the problem. But it's actually when you go back to your village and your kampung, what you do in the kampung is what causes the outbreak. When you go back to your family members, you think you are safe because you know them. When you go into your office, I guarantee that most of the people, even in our chat room, they don't wear their mask when they talk to their friends, when they go to their pantry, when they eat together, because it's a familiar face. Because the brain has been developed to say that as long as you know the person, you feel safe and secure. Yet you know COVID does not have this, right? It doesn't differentiate. So you cannot wait for the government to say, okay, nobody can go back for village. Nobody can go back. Because people will still go back. And Indonesia is so huge with such a large population that you cannot control the movement of people. Too many jalan. Jalan tikus, jalan belakang, jalan depan, jalan tepi, semua ada jalan.
That's
And
right.
so many ways for you to move, right? So no matter what you do, people will still move. So rather than you trying to stop people from moving, you put your effort and you put your focus on telling people, when you move and when you go back to your kampung, how can you be safe when you do that? What is the safe way of celebrating Christmas? What is the safe way of actually breaking your fast for Ramadan and for Eid al-Fitr? How can you do things safely? People will still meet each other. How you want to meet safely? People will still play football, they will still play, and they will still play sports with one another. How you can do it safely? Who should watch out for what? So this is the main important driver of public health principle, which is actually health promotion and education. So when you have people understand, then they are smart. So let's look at how we actually drop HIV infection. We tell people, if you have unprotected sexual intercourse, you can get HIV. So then people start to use condom. So at first they didn't use it, but as we move along, as we make people understand, we say, oh wow, now people understand how to prevent it. So this is exactly how you should actually do with COVID. You cannot depend on the government because the government will only think for the government. The government will only think about themselves. So they will only say policy which is popular, but they will never use policy which is actually that matters. This is to any government, Malaysia, Indonesia, Singapore, it doesn't matter. Right? But what is the most critical is making the people of Indonesia, making the people of Malaysia understand what is their responsibility. So in Malaysia, we are moving towards that already. We're telling people, if you want to go back to your kampung, you can go ahead, but before you go back, you do RTK test. So we have brought down the price of RTK now to 5 ringgit. So 5 ringgit is how much? I don't know. It's $1.20 US. I don't know how much is that in rupiah. Is it 10,000, 5,000 rupiah? Or 10,000 rupiah? I cannot remember. Right? So we've brought it down to be extremely, extremely low. Right? It's only $1.25 US to do one COVID test. And everybody can do it at home. And we tell people, you want to go back to your village? Go ahead, but test yourself. Before you come back from your village to the city, test yourself again so that we can stop. In case they are there, we stop them there. In case they are from here, we stop them here. So we give this education to the people that, look, you are doing this not for the government. You are doing this so that your parents in the village will not die. Your girlfriend who you're going to go and see will not die because she saw you. So this is the message that we're trying to give. And I think this is what you should actually move on towards, Aldi.
Okay, thank you, Dr. Farhan.
Thank you. I think Dr. Budi, you're muted.
Yeah. Okay, sorry. Thank you, Mr. Farhan. Mr. Farhan, you say that in this COVID era, Malaysia have 3 prime minister. It's maybe it can be advantage, but sometimes it can be disadvantage juga ya, karena political person have a different schedule with the public officer schedule and effort. So what you experience, your tips for us? Actually, Indonesia still have one president. Actually, it's good time for us, but in the fact maybe need more effort. So what is your tips for us and student how to advocation the public effort to the decision maker in Indonesia? Thank you. Oh, sorry. Unmute. Yeah.
I think one of the most critical and most important for all the listeners to remember is this, yeah. You have to start somewhere. You cannot think of you want to change the whole country in one day. You cannot change the whole population mindset in one day. So you start from your university, right? Can everybody in your university follow the public health guidelines that you have set? If you cannot pass your university level, you can never succeed outside. So once you have succeeded in your university, you go to the city which your university is in. If you succeed in that city, that you go for your region, then you can expand. And you think it's impossible, but trust me when I tell you, I went through it. I went through those types of levels, and we managed to accomplish it. And the most important thing is for you to tell yourself, if I don't do it, nobody will. So I'm going to do it. So if you wait for somebody to do it, nobody will do it. So you must tell yourself, I have to do it. I have to take this responsibility, because you will think, ada, I'm not special. Apa specialnya diriku ini? Kan? What is special about me? Trust me, you don't have to be special. You don't have to be somebody, a hero. You don't have to be anybody. You just have to be somebody, right? You just need to do action. And if you remember the principles of promotion of health, when you have the stage of pre-contemplation, contemplation, action, and then you have maintenance. So you have to translate whatever issues that you have right now into action, into translatable actions. So you have to move your ideas, you have to move the agenda into translatable action. And just doing something is not the most difficult part, but it is actually maintaining it. Every day you have to maintain, every day you have to give more effort into it. Because if you just do something, it just become like the politician. You come one day, you smile, you give something, and then you leave. And you never see the politician ever again until election comes. But what is the most difficult part? It's not about coming once. It's not about telling people one time. It's about doing it over and over and over again, every day, with the same amount of intensity, with the same amount of dedication, so that you will achieve even bigger than what you did before. And this is actually the reason why we actually managed to go all the way, because we just did not stop. They tell us it's okay, it's okay. We say no, it's not okay. No, it's not okay. And then we went further ahead. We went further ahead until at one point they say, okay, you know what? Now we have to start listening to them. We have to start listening to them because they just would not stop. So let's just listen. Right? And this is what you have to drive yourself towards. This is where you have to achieve your goals too. Right? You cannot give up, and you must put yourself into translatable actions.
Yes. Oh, thank you. So very inspiring, Mr. Professor Farhan. Our student and our audience, this point inspiring us that public health cannot run by itself. Politician, you know that almost all politicians, not public health officer, or maybe people who care about the health of the nation, or maybe many people. Usually, the politician come from the rich person and from the businessman, and they don't have any touch to the poor people and on the field. So it is what similar with Farhan Rusli mentioned. If the public health effort not our propose to the decision officer, nobody will care about this. So from Undip, every time in the study, I inspire you. You study not only to gain your master degree, or maybe you finish and then you increase your salary in the company, or maybe pangkat yang lebih naik. No, not only this, but we have a responsibility to use the data of public health in our places in Indonesia, to the decision maker, to the politician, not only one times. Mr. Farhan said, we cannot check one day. Even politician 1%, it need a much day. And also, if the politician berganti pemimpin setiap saat, maka kita harus jangan capek-capek untuk menunjukkan kepada politician yang rata-rata bisnismen yang tidak tahu data-data kesehatan. Kita kunjungi, kita audiensi, inilah data-data, dan Bapak dalam konteks ini bisa melakukan perubahan-perubahan kesehatan masyarakat. Ini sesuatu yang inspiring, sehingga adik-adik semuanya, mahasiswa dan audiens, kita punya amanah yang sangat luar biasa. Banyak problem, tidak hanya COVID. Kita punya problem tentang prevention untuk cancer. Bagaimana kita tahu banyak ibu-ibu kena cancer saat ini, hampir 70% grade-nya adalah grade 3 dan 4. Padahal kalau cancer payudara grade 3 ke 4 itu artinya risiko untuk kematiannya sangat tinggi sekali. Kalau misalnya grade 1, 2 kita bisa promote mereka untuk screening awal, begitu juga cancer mulut rahim, begitu juga cancer paru-paru untuk para pria dan perokok. Ini bisa menjadi sesuatu yang bisa menyehatkan masyarakat. Dan tentu saja, sekali lagi, like Profesor Rusli said, it's not change in one day. Effort terus-menerus, sehingga Anda harus mendapatkan inspiring kalimat ini menjadi amanah di hati Anda, bahwa Anda yang saat ini student bisa saat ini membuat surat, membuat apa kepada decision maker yang ada di tempat Anda, bahkan sampai Pak Jokowi pun bisa, dan terus-menerus dijadikan kegiatan ini sebagai bahan perjuangan kita semuanya. Kita masih ingat punya Budi Utomo, seorang dokter yang akhirnya dari orang kaya, dia melihat banyak orang yang miskin di daerah, yang obatnya dari kemiskinan dan hangerudin di masyarakat adalah bukan obat, bukan vitamin B kompleks dan antibiotik, tetapi adalah keadilan. Nah, contohnya ini. Maka bagaimana membentuk keadilan? Salah satunya dengan kemerdekaan. Nah, termasuk dalam konteks public ini, Anda harus melakukan apa yang menjadi teladan pahlawan-pahlawan itu, dan mengikuti salah satu basic science of public health, yaitu data sebagai suatu pisau yang sangat kuat, dan kemudian gunakan data itu untuk mengadvocate, untuk menjadi kebijakan. Ini sesuatu yang sangat inspiratif sekali. Dan jangankan Anda banyak orang seperti ini, satu orang saja itu bisa merubah keadaan, apalagi kalau saat ini ada 200 student dan audiens yang ada ini bersatu untuk mengegulkan sesuatu. Ya, barangkali masih ada pertanyaan lagi. Saya mohon ini teman-teman, mumpung ini kita ketemu dengan Bapak Profesor kita yang ternyata orang keturunan Jogja, dan barangkali ini masih tetangga kita sendiri, saudara kita sendiri. Siapa tahu yang boleh bertanya tentang basic science, public health maupun COVID, bahkan mungkin possibility, wah Bapak Profesor mau nggak nanti jadi pembimbing tesis saya? Nah, seperti itu boleh juga. Nah, atau yang belum punya pacar, masih punya adik yang cakep-cakep seperti Bapak, enggak? Boleh juga, enggak apa-apa. Ya, oke, mari teman-teman, adik-adik semuanya. Ada pertanyaan, saya menunggu baik langsung maupun lewat chatnya. Kita waktunya masih banyak, teman-teman. Sambil menunggu itu, saya ingin menambahi sedikit, mumpung kita punya expert yang luar biasa yang harus kita gali sedalam-dalamnya untuk kebaikan kita, ilmu kita. Tadi ada istilah translatable. Bagaimana membuat data-data kesehatan ini menjadi translatable dalam konteks public health policy. Ini sesuatu yang sangat inspiratif sekali. Translatable ini sesuatu yang sangat menarik sekali. Mungkin Pak Farhan bisa ajari kita bagaimana membuat data-data public health ini menjadi bisa diterjemahkan menjadi suatu kebijakan politik. Langkah yang paling sederhana apa sampai yang kemudian menjadi kebijakan, menjadi undang-undang, menjadi peraturan daerah, itu langkah-langkahnya bagaimana ini? Barangkali kita sangat memerlukan. Terima kasih.
So bila kita mention about translatable action, pertama sekali apa yang penting ialah kepada siapa kita ingin menterjemahkan data itu. Kerana kalau kita ada satu set of data, kita ada 5 audience yang berbeza, apa yang kita ingin ceritakan kepada 5 orang ini ataupun these 5 different people is going to be very different. So let's say I have a number of COVID infections. All right, that's the data that I have. And my audience, I have a doctor, I have a politician, I have the general public, I have the prime minister, and I have, for example, the nurse. So these different people, the thing that is important will be very different, right? So for the nurse, what do I tell? What do I translate these translatable actions to be? So I tell the nurse, this is the indicator that you have to look. If it goes up, that means you have to prepare the staff nurses, you have to prepare this. So this is the things that you need to know and you need to understand. It's the same graph. Everybody gets to see the same graph. But how you explain to the different people will be very, very different. When you explain to the doctor, it's about them trying to prepare themselves for the number of ICU, the number of ventilators, for example. And then you talk on the lay public. When you tell the lay public, what is it that you're trying, the message that you're trying to give to them? What is it that you're trying to pass the message to the lay public? You tell the lay public, if this graph goes in this direction, your freedoms goes away, which means that you cannot go outside your house, you will be in lockdown, you will be put in your house. But to prevent you from doing this, these are the steps that you need to take. So what are the steps that you need to take? This. So you need to tell the people, you make sure you wear your mask, you make sure you have physical distancing. So that's translatable action to the people. But when you talk to policymakers, such as the politician or the prime minister, it's going to be very different. Because for the prime minister or the politician, you cannot tell them, I'm going to keep you at your house, you cannot go out and all these things, because they will still go out. But your translation to them, penterjemahan data kepada mereka will be different. How so? You will tell them, for every increase of cases in this region, you will lose the country by how many billion? You will lose by how much? How affected is the economy going to be? So when you present data to the different population and you translate data to different people, your audience, you must know who your audience actually is. And from there, you will be able to tell your audience, the translation, penerjemahan itu, barulah penterjemahan itu boleh diabsorb oleh your audience, and that will be converted into action ataupun perubahan. So public bila dia dengar data itu, the translation, the terjemahan yang you dah bagi untuk data itu, dia akan dapat, okay, I have to make sure I maintain SOP. I have to make sure I wear mask because I want to go outside the house. That is, whatever you tell them, that is the translatable action that they do. For the politician, they get the idea. Okay, if I don't change my policy, the country will lose money every single day. If the country loses money and the economy drops, then my rating as a politician will drop. I might be tucked out and I might not be elected as the prime minister anymore. So this is what I'm going to change. This is the policy that I'm going to instill so that I can prevent it. So I wouldn't say you, we as the public health experts, we are actually the one who are able to analyze that data. We're able to take that data and we're able to present it to the different groups of population, and how you present to this different group is what is actually translatable to actions. And that is the key component. You cannot tell what you want to tell the Prime Minister to the lay public. You cannot tell what you want to tell to the lay public to the doctor. It doesn't make sense to the different groups. So that is why your ability to have effective risk communication so that you can deliver the message of translatable action is very, very important to achieve your public health change and to achieve your public health goal. So that's the key message there.
Yeah. Yes. Thank you. Inspiring. Ya, adik-adik semuanya, para mahasiswa serta para audiens, kita bisa lihat bagaimana untuk membuat data-data public health kita menjadi suatu kebijakan publik itu perlu waktu yang sangat panjang dan perlu ketelatenan, kesabaran tertentu. Tetapi juga memerlukan cara-cara yang sangat tepat untuk berhadapan dengan orang-orang. Saat ini kita dalam suatu negara di mana demokrasi menjadi salah satu jalan kita untuk maju. Dan kita sekarang tadi disebutkan oleh Prof. Farhan Rusli, bahwa kalau kita bicara dengan politician, kita bisa membuktikan bahwa apa yang menjadi pemikiran kita itu bisa meningkatkan negara, pemerintah, bahkan akhirnya meningkatkan elektivitas mereka. Sehingga mereka bisa bertahan. Kalau misalnya tidak bagus, mereka bisa diturunkan atau tidak dipilih lagi pada pemilu yang akan datang. Ini sesuatu yang sangat penting sekali untuk kita pikirkan dan menjadi satu peluang untuk kita memberi highlight pada upaya-upaya yang bisa kita lakukan secara nyata. Baik, ini ada pertanyaan dari Mas Kristiawan. Silakan Mas Kristiawan, unmute.
Yes, thanks, Mr. Budi. Can you hear me? So clear?
Yes, clear. Okay.
Okay. Thanks, Mr. Rusli, for your presentation. I want to know what the key learning or keyword from the health principle from the various your experience, and we know that we have a lot of limitation, various such as the economy, political, and also the culture, right, in Indonesia. So maybe we want to know what your suggestions concrete to overcome limitation in Indonesia with the principle what had in your experience. Thanks. Can you get my point? I'm sorry.
So you want to know how to change, what's the lessons learned due to the various different reasons on which principle?
We use like one had a principle. We know that we have a lot of limitation in Indonesia, right? From the political, economic, social, and cultural also. So maybe you have key learning or keyword, so we can use in Indonesia, because we know we need the time, we need more effort, yes, from all the partisan in Indonesia, I think. Thanks, Mr. Rusli.
So if I can understand, correctly, it's how you want to advocate One Health principles into Indonesia because of the multi-ethnic, multiracial demographic of the country, and
Yes,
what are the things that I have learned from Malaysia for to advocate it. Number one, you have to always remember something. Yeah, no matter what you do, you will always have disagreement. No matter what you do, from any society. So let's say Indonesia, I think you have bangsa Melayu, you have the bangsa Cina, and you also have all the other ethnic groups. I cannot remember, but beyond bangsa, you also have the different regions, right? You have Jawa Timur, Jawa Barat, Jawa Tengah, kan? You also have Sumatra. You have the different things, and everybody seems to have their own idea or their own belief into the different things. So it's similarly like in Malaysia. Actually, it's everywhere around the world. The most critical thing when you approach these different places or the different regions or different population is you must always try to be a part of their community, or you must always use the services of who is their community heads. Because you have 300 million people in Indonesia. You cannot go to 100 million people. Impossible, right? Impossible you can go to 300 million people. So in Malaysia, we cannot go to 35 million people. So what do? We get the heads of all these people to come to us, and we make them understand what is the agenda that we're trying to achieve. What is the message that we would like to go across? Because the moment you have to remember that if you are somebody who's from the outside, let's say you go to Papua, you talk to the people in Papua. Do you think the people in Papua will listen to you? They won't, right? You go to Riau, people in Riau will listen to you? They won't listen to you, right? Number one, they don't know who you are. Number two, they don't care about what you have to say. Number three, if they don't care about the first two, no matter what message you want to give, it will never get across. So that is why it's important for you to engage stakeholders. And this is where the governments must also learn. Sometimes you dictate policy, what you think is actually important. But when you go to the region, you cannot enforce it. It is not enforceable because the people don't listen to what you are. But if you use the stakeholders in the various regions and you tell them what is the key message, what is the key policy that you want to achieve, they go back to their communities. They are the ones that you explain. So if you look at the example that I gave during the lecture just now, this is why when we had the refugee community, we did not go to all the refugees, but we asked all the chief of the refugees, who is the head of the Rohingya community, who is the head of the Myanmar community, who's the head of the Nepal community. We took all these heads of people and then we brought in translator and we explained to them, this is what is happening, this is what you need to do, and this is what we want you to achieve when you do this. So these people then go back to their communities and they deliver the message in the way that they believe their community will be able to accept. So this is the key message. It's not about you trying to impose to people or trying to give the message to people, but you have to make the stakeholders understand what is the message that you're trying to deliver. And that message is then derived and broken down to the specific community so that they understand. But in the end, you achieve the goal. So this is what we call about effective risk communication, effective public health policy and translation. So this is the key message that you must remember, Christiawan. I hope I answered the question.
Okay, thanks, Mr. Rusli. I got your point. Thanks.
Yes, thank you, Pak Christiawan. And now we have another Benina da Costa. Maybe you can, Benina da Costa. Do you want to ask something? Okay, everybody want to make question, please? Yeah. Do you want to make question, Benina da Costa?
Hello, doctor. Can you hear me?
Do you want to ask something? Any question for you from you?
Yes, yes. I just want to clarify something from Doctor.
Okay.
Can he hear me?
Yes, yes, of course. You can.
Hello, Dr. Farhan.
Hello, yes, I
Okay.
can hear you well. Go ahead.
Okay. I just want to get a clarification. You know, when you started, you mentioned that the COVID crisis, the COVID-19 crisis was put under check, not necessarily because of the public health intervention in place, but due to the vaccination. You said that in quote, but I just want to get the clarification that what you mean by vaccination, were you actually referring to the efficacy of the vaccine, or is the confidence that it has instilled in the people that, okay, with the vaccines, we can actually return to our normal lives? That's what I want to clarify. Were you referring to the efficacy of the vaccine or the confidence it brought about? Thank you.
Okay, thanks for the question. I was referring to the efficacy of the vaccines, not the confidence, because technically the confidence is just barely there, isn't it? But it's actually more on the efficacy of the vaccines. And why I say that we are headed for another wave in Malaysia is because due to the data that's coming in on the efficacy of the vaccine, we know that the Sinovac recipients, first and second doses, after 3 months, the neutralizing antibodies drop up to 28%. So it's almost two-thirds loss, more than two-thirds loss on the neutralizing antibodies after 3 months. And that's why the Sinovac recipients in Malaysia, after their second dose, after 3 months, we are going to give them a booster dose. Usually, most likely, they will be getting the mRNA Pfizer vaccine. So, but our issue now is that we are seeing a drop out rate of almost 40% for the booster doses. So this is where we see that even when people feel that they are already covered with the vaccine, that in about December to January, we will see an uptick in the number of cases because these people who should be getting booster doses are not getting it. So this is our biggest fear right now. And when I talked about the number of curves being brought down, not due to the public health response, because the vaccination is what saved us, right? It's not about people complying to SOP. It's not about the government's policy that made it so well that the COVID-19 cases have dropped, but it's just our effective rollout of the vaccination program. But this is dangerous. Why do I say this is dangerous? Because now the government of Malaysia believes that we can face any pandemic, we can solve it. But the reason why we solve this one is because of the vaccine, not because of our public health policy. So you cannot take into account the vaccination as part of your public health response because it's completely different, right? Your public health response is your effective fine, your testing, your tracing, your isolation, your support. That is your public health response. Vaccination is just part of the public health response, but it should not be your golden standard rule. Because in case you get another disease, which you don't have the vaccine for, then the country is left in tatters, like you'll burn down to the ground because you don't have digitalization ready. You don't have data centers ready. You don't use artificial intelligence in the best way possible. You don't have infrastructure to cope with the rising number of cases. So this is actually what needs to be spent on, not on the vaccine itself, but rather your public health infrastructure. That is the most important.
Okay, thank you. Another question from Ropik. Mas Taufik Hayat. Maybe it is case of the part of culture in Indonesia, Mr. Farhan, that in the Sunda area, that is the West Java, they have no much learn now about the word of F, so they only have P. So usually people have a F, so this name Ropik. no Rofik, usually Rofik. Yeah, it is typical of the culture in Indonesia. Also in the Makassar, they have no N, but they have Ang. So when we speak one another, something funny. Rofik Taufik Hidayat want to ask about the problems in Tasikmalaya, but not in Tasikmalaya. It is in Indonesia, in Malaysia, or maybe in the world. Because in the big question now, in the some part of in the world, the COVID decreased sharply, and now in Tasikmalaya, Rofik say, in this city have no patient for COVID again. It is the success of immunization, or maybe PPKM, isolation, or maybe it is a phenomenon of the virus that maybe it's not and not matching with the climate or anything. And because this question sometimes grow in the many thinking of the people, it is about the engineering of the war of virus in the world. Maybe you can give the perception or anything. Thank you.
I think before I can answer that question, maybe I can ask Master Ropik. You say that there are no cases, but may I know how many COVID tests have been done daily? Because you have to answer that question in the beginning. How many tests? If you don't test, your number will be 0. Tomorrow, the whole world don't test. COVID case in the whole world will be 0. So you cannot look at it just from one number. And this is back to our basic principle, right, Dr. Budi, where we say that data, if you show the people data, whatever you want to show, you can always explain it. Tiada case di Kota Tasik. Kes COVID adalah kosong. Betul ataupun benarkah ia kosong? Kerana soalan seterusnya yang harus ditanya, berapakah jumlah ujian yang dilaksanakan? Adakah ia hanya 2 ujian? Adakah ia 200? Adakah ia 2,000, 20,000, 200,000? Berapa jumlah ujian? Kan? Kosong itu tidak bermakna kita selamat. Ya, di Malaysia hari itu kita test, kita kata oh kes kita sudah kosong. Testing very low. Lepas tu bila kita test banyak balik, oh jumpa sampai 25,000 satu hari. Yeah, so it's very dynamic in that sense, right? So when you think about it, you cannot look at that. And as experts, as epidemiologists, as public health personnel, it is our duty to educate the public. Do not look at only absolute number. 0 means nothing. You have to relate it to something, right? Kalau dia kata di hospital adalah kosong, berapakah jumlah kematian yang berlaku di rumah? Kan? Because in Malaysia, we still have people dying at home, and it's very sad for us because it shows that we are still missing a lot of cases. Our aim is to have 0 death at home, but it's still not achievable. We still cannot achieve that, and that means our public health message is still not yet set. And that's why I think it's not about the vaccination, it's not about public health response ke apa ke semua. It's just about data manipulation. And all governments love it when they want to show the people and the world that they are doing better, that they're doing good. But you as public health expert, you must ask back the government. Kenapa kosong? Berapa test you buat? Betul ke you buat berapa test? I want the proof. Bila last you buat test? This is the things that you must ask back to your government and your policy makers. Don't just take whatever they give to tell you that we are better, we are now good. It's very different, Dr. Budi.
Yes, thank you. Oh, ini sangat membangunkan kita semuanya. Terima kasih. Ya, Mas Taufik dan kita semuanya, kita harus memahami basic of science, filosofi basic of science seorang ilmuwan. Memang ini tidak semuanya dianggap oleh orang baik. Tipe seorang ilmuwan itu selalu bertanya, ya kan? Betulkah bulan dunia ini bundar misalnya? Betulkah bulan itu bercahaya atau diam? Ini suatu saat harus dibuktikan. Nah, pembuktian ini dalam COVID ini diwujudkan dengan data yang betul. Seberapa jauh kita itu melakukan. Kita jadi ingat beberapa waktu yang lalu, many weeks or maybe months ago, some area try to cover the real data of the COVID, not only in the some area, even in national Indonesia. Some data want to be covered by something that they think that coverage the number will be make people feeling nice, feeling okay, but it's dangerous. Kita seperti menanam bom waktu. Nah, makanya sebagai seorang ilmuwan boleh kita bersenang hati karena angkanya menurun, tetapi kita tidak boleh berhenti. Kita harus cek betul apakah betul darah kita itu tracingnya baik dan sebagainya. Sebagai sampel hari ini, begitu kemarin ada sekolah-sekolah yang masuk, dicek ternyata ada 30 orang yang positif. Artinya apa? Artinya sebenarnya masih ada. Lah, kemudian pertanyaannya, ini kan tidak menyebabkan kematian, ini menyebabkan hospitality, orang dirawat di rumah sakit. Ini kita kembalikan pada basic science of COVID. Kita tahu bahwa COVID ini menginfeksi 100% orang yang terinfeksi, tetapi yang menimbulkan gejala itu hanya 10%. 90% ini adalah orang yang menjadi karier saja, barier. Karier ini yang akhirnya suatu saat ketika dia tidak kita isolate, dia akan keliling dan pada orang-orang yang rawan. Orang rawan itu siapa? Orang yang umurnya lebih dari 50 tahun, orang dengan penyakit-penyakit bawaan yang mendasar seperti kolesterol, diabetes, dan sebagainya. Begitu dia mengenai, inilah jadi kematian. Nah, inilah sesuatu yang sebenarnya tidak boleh membuat kita tidur. Dan Tasikmalaya, nggak cuma Tasikmalaya, seluruh Jawa Barat, seluruh Jawa Tengah, seluruh Indonesia. Jangan berbangga dulu, tetapi kita harus selalu melakukan tracing dengan cara yang benar. Ketika suatu saat menurun, tapi kita tidak ada tracingnya, kan ada laporan testingnya. Berapa testingnya? Ketika testingnya itu kurang, maka kita jangan berbangga hati, karena itu menjadi silent killer di masyarakat, seperti dalam konteks ini typhoid, seperti itu. Betul begitu Pak Farhan, Rusli ya? Ya, terima kasih. Nah, ini sebelum sepertinya sudah siang, saya akan tutup, dan sebelumnya saya tutup, saya ingin inspiring Anda bahwa ada beberapa poin yang sangat penting sekali di dalam pembelajaran kita dari Profesor Farhan Rusli ini. Pertama, bahwa kita di Health Officer itu mempunyai data-data, dan data-data itu sebagai epidemiolog harus diterjemahkan. Dalam penerjemahan ini untuk menjadi suatu kebijakan publik, kita harus fighting betul, kita harus berjuang. Dan itulah yang namanya perjuangan kita sebagai public health expert atau petugas kesehatan itu di situ. Di mana kalau letaknya kita, kalau kita tidak melakukan ini, maka sebenarnya sebanyak mungkin kita itu mencetak public health expert seperti Anda, maka kesehatan kita tetap tidak akan berkembang sama sekali. Itu terjadi saat-saat ini ketika kita tidak menyuarakan suara kesehatan masyarakat menjadi suatu kebijakan yang applicable di masyarakat. Kemudian juga kita mempunyai beberapa contoh di Malaysia, bahkan di Undip di Indonesia pun kita punya contoh bahwa setiap dari Anda itu bisa menjadi change maker, perubah keadaan. Contohnya dalam konteks sanitasi, dari riset kecil, ya, sanitasi jamban di Gunung Pati 10 tahun yang lalu, sekarang menjadi national effort, dan ini masih kita perjuangkan terus. Artinya apa? Artinya setiap dari Anda bisa menjadi hero-hero di dalam suatu problem kesehatan. Dan kesehatan di Indonesia dalam publik itu masih banyak yang belum diperjuangkan. Kita punya kanker wanita, kanker pria, kemudian kita punya kecelakaan lalu lintas yang menjadi salah satu kematian tertinggi di Indonesia yang preventable. Kita masih punya kematian-kematian, kesakitan-kesakitan karena penyakit menular yang lain. Kita masih punya kematian, kesakitan karena environment yang buruk, baik itu karena industri yang buruk atau karena bahkan industri rumah tangga yang buruk. Ini memerlukan effort dari kita semuanya, dan bagi Anda yang tertarik bisa menjadi salah satu pelopor ini di wilayah Anda masing-masing. Anda punya ilmu, punya amanah, sekarang bisa melakukannya. Terima kasih sekali. Pertama kami tujukan kepada Profesor Farhan Rusli yang sangat luar biasa menginspiring kami semuanya dan adik-adik, teman-teman, semua mahasiswa dan staf di Public Health Universitas Diponegoro dan para audiens di luar kampus yang sangat peduli dengan kesehatan masyarakat juga. Ini adalah perjuangan kita bersama-sama yang harus kita lakukan dengan fighting, dengan perjuangan, dan tidak akan berubah dalam waktu harian, tetapi memerlukan ketelatenan, perlu kerajinan untuk selalu menyuarakan kesehatan masyarakat. Demikian sekali lagi saya ucapkan terima kasih dan karena sudah cukup siang, kami akhiri. Insya Allah ilmunya bisa bermanfaat dan kami serahkan kembali waktu kepada panitia. Terima kasih panitia. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Yeah, thank you, Assistant Professor Muhammad Farhan bin Rusli and Dr. Budi Laksono for the speech and discussion. It's very eye-opening to learn about COVID-19 and One Health from our neighboring country, Malaysia, in which we can adopt good value to our work or our area of expertise, and we can learn a lot about COVID and One Health from Malaysia. So on behalf of the committee, we would like to remind you to make sure that all of you already filled the attendance list in the Google form in the chat box, because the certificates will be sent directly to your email. Ya, kami menghimbau Bapak Ibu sekalian untuk mengisi daftar hadir di Google Form di kolom komentar, karena sertifikat e-sertifikat akan dikirimkan secara email ya Bapak Ibu. Jadi mohon diisi emailnya dan nomor HP-nya juga di kolom Google Form yang telah kami sediakan di kolom komentar. On the behalf of the committee, we would like to say thank you very much for all the participants for the attentions, and also we would like to say sorry for any mistakes during this seminar. We look forward to comments and kritik dan saran dapat disampaikan kepada panitia ya Bapak Ibu apabila ada kritik dan saran dapat disampaikan melalui WA kami. We also would like to say thank you for our keynote speaker and moderator, and also all of the participants here. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone.
Waalaikumsalam warahmatullahi wabarakatuh. Makasih, Dr. Farhan. Pak Budi, makasih.
Ya, terima kasih.
Terima kasih.
Terima kasih, Dr. Han. Izin saya mencatat nomornya Pak Farhan.
Boleh. Saya dah letak di chat group tadi.
Ya, terima kasih. Mahasiswa student semua, boleh kiranya nanti kalau Pak Farhan punya waktu, COVID sudah selesai, bisa kita bajak ke Undip untuk live seminar, gitu ya Pak Farhan ya. Terima kasih.
Ya.
Oke. Terima kasih semua.
Ya, terima kasih.
Terima kasih.
Baik, Bapak Ibu dapat meninggalkan Zoom ya. Acara sudah selesai. Namun pastikan sudah mengisi kolom komentar tuh ada Google Form ya untuk attendance list-nya untuk daftar hadirnya. Terima kasih.